Well, the first official day of spring arrives Thursday, March 20th, but for allergy sufferers, well, the symptoms are already here.
Yes, and spring brings with it not only allergies, but sinus symptoms as well, especially after the recent devastating fires here in Los Angeles. Today we have Dr. Marc Kerner, ear, nose, and throat specialist with Cal West Head and Neck Surgical Institute and Dignity Health Northridge Hospital to help us sort of navigate the season a little bit. Hi, good to see you again.
Good afternoon. Thanks for having me.
Let's talk about this. So these fires happen, there's particles in the air. A lot of people have gotten air filters. We're doing everything we can. What are some of the issues that you're seeing because of the fires?
Well, we're seeing a couple things this year, especially this was a bad flu season. So we're just coming off the winter flu season with a big increase in viral infections. And then with the addition of the fires and all the particulate matter that's been put into the air, we're now seeing an even bigger increase in people with allergy and sinus problems.
All right, so a lot of people out there, they'll check the weather app to see what the air quality is. How accurate is that?
Well, I think there's a number of different apps, number of different organizations that do track that. And I think they give you a fairly decent indication of what's going on. And if you're a sensitive person with a lot of underlying medical problems, especially pulmonary problems, it would be helpful to know so that you're not going out and being exposed to high levels of particulate matter.
Right.
I think a lot of people get a little confused between allergies and then, or do I have a sinus infection? So can you clarify that?
Yeah, that's a great question. We get that all the time. So typically allergies are seasonal, so they'll come along at certain seasons when the pollen counts are higher, and it'll be characterized by nasal congestion, runny nose, itchy eyes, itchy throat. You'll also get some watery eyes, postnasal drip, and maybe a cough. Sinus infections will typically be shorter acting. They'll be usually much more severe. They'll have facial pain, pressure, more purulent or infected looking discharge, and even sometimes fevers, not seen with allergies.
All right, so what are the tests out there that we should all take?
So for those people that are suffering long-term from allergies, allergy testing with either skin testing from an allergist or blood tests are helpful to determine what you're allergic to. In terms of sinus infections, you can be examined. Just a physical examination can determine whether you have a sinus infection. And then for people that are suffering long-term from sinus infections, we get them x-rays or CAT scans.
And what does that do? Just to see what's going on down there?
Right, delineates the anatomy, allows us to better characterize what the causes are, since there's a number of causes, and whether it's something that needs more long-term or more aggressive treatment.
The home remedies are interesting sometimes. I know there's one, I don't know if it's neti pot or something like that people use. Do those work?
They do. We're big fans of them. We use them on patients all the time. But the neti pot is actually, what you're doing is just flushing out your nose and sinuses. So you're getting that particulate matter or those allergens that are settling in our nose, which is really nothing more than our filter, and cleaning that filter out. So whether you use a neti pot or a Navage device or any sort of just saline irrigations, they're all great, and we're big supporters of all of them.
All right, when do you get to the point where surgery is needed or it's an option?
Well, surgery would be indicated for people that don't breathe well through their nose, either from anatomic issues. In terms of allergies, there's no real surgical treatment for allergies other than sometimes treating what are called the turbinates. But for patients that are suffering from long-term sinus infections, then surgery would be indicated. Now we have a whole panoply of minimally invasive procedures that are quite helpful. And now there's a whole new set of new medications that are helpful for both allergies and sinus disease.
What you're doing there does not look comfortable. Is that a camera?
Yeah, that's just an examination. We're doing a nasal endoscopy, and it's actually not very painful, believe it or not. But it does allow us to see right into the sinuses and get a extremely good idea of what's going on.
Doctor, as we wrap up, we talked about those air filters. I have one now in my living room, and I'm like, is this really working? But you say yes.
Yeah, they do help. I mean, it's very helpful. I mean, you should also make sure that your filters in your air conditioning and heater systems are changed regularly, but it will filter out enough particulate matter so that if you are sensitive, it will reduce that sensitivity.
All right.
Yeah, I've tried the Navage machine. Problem is, boy, you get a little wet it's worthless. It doesn't work after that. So you just got to keep it dry. But it's an amazing
I
product.
don't know what you're talking about.
So
but
when you hold up and it squirts water in one nostril and all comes out the other nostril. Yeah.
Wow. Okay. Well, thanks for all the great information. I know.
You're welcome.
It's all good. Better than whatever he was doing there on the camera. I mean, on the. All right. If you need any information there, Dr. Kerner, you can log on to dignityhealth.org.